Welcome. I'm Jennifer Carlson, Pro Vice Chancellor Advancement at the University of Queensland. Today, we'll learn more about UQ's COVID-19 response, including a look behind the scenes on how the promising COVID-19 vaccine is progressing. First and foremost, we pause to acknowledge the traditional owners and their custodianship of the lands on which we meet today. I pay our respects to their ancestors and their descendants who continue cultural, spiritual connections to country. We recognize their valuable contributions to Australian and global society. Now, before we begin, I'd like to point out a few items to make the most of your experience with us today. This webcast is being recorded, and in the very unlikely event that technical issues arise, it will be made available to view tomorrow via the same link. I'd also like to point to the interactive features on the webcast player you're watching right now. It should be right below me. So next to the timeline, you'll notice the speech bubble. That's the comment box. If you'd like to pose a question or comment at any time during this webcast, please click on the speech bubble. And in fact, if you'd like to give it a go right now, it'd be a great time to put in the chat box where you're viewing from tonight. We have alumni from around the world tuning in, so please do say hello. We'd love to know where you are. So today, as you've already seen, is our annual Giving Day. Like most things in 2020, we're doing things a little bit differently this year. In 2019, our first ever Giving Day at UQ, you, our community of ChangeMakers, in partnership with the university, helped to raise an unbelievable $2.1 million to support students experiencing financial hardship, along with critical research efforts and many other important endeavors underway at UQ. We know not everyone will be in the position to give this year, but for those who can, please know that all gifts, no matter the size, are very deeply appreciated. So in a continued effort to support our students experiencing financial hardship, now more than ever, I'm delighted to share that any gifts to the Student Emergency Fund will be matched by our university, dollar for dollar. Together, we really are able to create a lot of change. So COVID-19 has disrupted the world, we all know that, but we've seen one significant truth: the good doesn't stop. Today, we aim to showcase just that, the good. And because it's our Giving Day, we'll be focusing a little bit throughout on how our donor community has helped us to accomplish so much. Now, if you are following along on our social media channels, you've likely seen many stories of impact and transformation made possible by our donor and alumni community around the globe. And one such example that's been in the news quite a lot, is the role of donors in helping to fast-track the UQ vaccine for COVID-19. While extraordinary research expertise is, of course, critical to the development of a vaccine candidate, it was the 2,600 plus donors, along with our governmental partners and organizations around the globe, that helped to raise the necessary funds to accelerate the timeline by 6 months. To share more about that vaccine and the broader UQ response to COVID-19, we have 3 very special guests with us today: Professor Debbie Terry, Professor Trent Monroe, and Professor Stewart Carney. As I'm sure many of you know, Debbie is UQ's new Vice Chancellor, and in addition, she's the chair of the Board of Universities Australia, a fellow and past president of the Academy of Social Sciences in Australia, and well, the list continues. Debbie has had a bit of a homecoming to UQ as she began her career at the University of Queensland, and we are nothing short of delighted to welcome Debbie back as Vice Chancellor and President. Trent is a senior group leader at UQ's Australian Institute for Bioengineering and Nanotechnology, as we like to say, AIBN. And along with that, the director of UQ's COVID-19 vaccine project. Amongst many other things, he's the director of the National Biologics Facility and Program, and the director of the CEPI-funded Vaccine Rapid Response Pipeline. Stewart is Deputy Executive Dean and Medical Dean of UQ's Faculty of Medicine, as well as a psychiatrist. Before joining UQ in 2017, Stewart was a Dean of Medical Education and Vice Dean International in the Faculty of Life Sciences and Medicine at King's College in London. So welcome, everyone, and thank you for being here with us today. Now, many of you, including myself, are very eager, I'm sure, to hear about the progress of the vaccine, and I promise that soon Trent will share that with us. But there are some very somber motivations behind the urgency around the vaccine efforts, of course, that we're all aware of. Just for a bit of background and a bit of a reminder as we enter this conversation, COVID-19 has not only presented us with unbelievable health challenges associated with contracting COVID-19, but also the very real mental health implications that have come with financial pressures, homeschooling, social isolation, and of course concerns for our loved ones, whether they're near or far. And of course, unemployment rates have already increased significantly. I certainly look forward to hearing from our Vice Chancellor about the job market and of our 2020 grads and beyond, and the role of universities at this critical time. But first, as we engage in what I hope to be a really fun and enjoyable panel discussion, I'd like to start with a very, very important topic of mental health. Stewart, if I could ask you the starting question. You've been closely monitoring mental health for some time of both staff and students, particularly since the launch of UQ's mental health strategy in 2018. Have you seen more recently a spike in requests for mental health support this year?
Thank you very much, Jen. I think that's a really important question, and perhaps before I talk about what we've seen this year, it might be helpful to provide a bit of context about a mental health strategy. We launched the mental health strategy and the implementation plan about 2.5 years ago. It was developed with and for students and staff. Our entire community are behind it, working together to shift the culture, to combat stigma, provide greater support to students and staff, and in particular to encourage early help-seeking behaviour. One of the issues we've been particularly concerned about is how can we ensure individuals access help at an appropriate time at an early stage to reduce the risk of today's struggles becoming tomorrow's crises. And some of the early signs in the first few years of our mental health strategy implementation, particularly if we look at counselling attendance and appointments, are that whilst yes, we've seen an increase in counselling appointments during those first 2 years of the strategy, a 30% increase in those seeking help. What we have seen is a 23% reduction in those needing crisis appointments. And I think that's a real signal about the importance of early help-seeking behaviour and shifting the culture within our community. As far as the challenges we faced this year, and looking at data both from the student and the staff side, and perhaps I'll start with the staff side, one of the metrics we have to measure psychological distress and the needs of our community are what are the presenting issues that our colleagues are accessing the employee assistance program for. So a year ago, around 25% of the contacts to the employee assistance program related to mental health issues. This year, in the context of COVID-19, that has risen to around 37%, and I think that's a signal of how mental health is impacting members of our academic professional staff and broader community. As far as students are concerned, if we compare semester one this year with semester one in the previous year, we've seen a 20% increase in individuals seeking help from our student services, and a range of services from counselling to crisis support, to a 58% increase in those individuals accessing the international student and welfare support. And I think critically, because we know it is a risk factor for mental health, we've seen a dramatic increase in the number of individuals seeking financial support.
Thanks for that, Stewart. That's, it is sombering, but it's just showcases how important it is to have those services available and ready to go. It sounds like it's played a really critical role. Debbie, maybe that's a good transition over to you related to student emergency support and that increase in requests for support. That was established, or the Student Emergency Support Fund, I should say, was established to provide financial support to those students who need it the most. I'm humbled to say that the response from the donor community has been amazing in terms of supporting the students during this time, particularly from our staff community. Could you tell us a little bit more about how those funds are being spent to support students at UQ?
Yes, no, thank you, Jen, and delighted to be here today. And can I join you in thanking all of our donors to that very important fund? And I'm certainly aware that it was both alumni, but certainly a lot of our staff also contributed. That fund has been absolutely critical. We've received more than 1,300 financial hardship applications, and around $900,000 in hardship funding has been approved and provided to students who are really suffering quite significant hardship, because as we know, there's been a lot of loss of employment, particularly those part-time jobs that are absolutely critical for our students. In addition, and this goes back to some of the comments that Stewart has made, we opened up our call centre for 7 days a week rather than 5 days a week 21,000 phone calls to our students were made by staff just to check in with students to see how they were going, and lots of evidence that that was really important, those check-in calls. We also, as much as possible, made available paid work hours for students, about 3,300 work hours. Mentors were offering their support to students, so student mentors, and again that's a very good way of providing support from one's own colleagues. Grocery hampers, 9,000 grocery hampers, so students not having enough money to buy food, 28,000 meals provided to students. So it's been a wonderful display of the strength of our community, both our alumni community, our staff community, our student community, and that care that just pervades everything that the university does.
That's just inspiring. It sounds like the efforts are really making a difference, and I'm sure it will certainly continue, and that they'll be keeping a close eye on the growing needs that are anticipated. Stewart, back to you. You mentioned financial distress is sometimes a warning sign in regards to mental health. As parents, colleagues, and friends, what are some of the other things that we should be looking for to help?
Thanks, Jen. It's a really important question, and as I've said, I mean, we certainly have seen an increase in mental health issues during the pandemic, and financial distress is a sort of a major sort of risk factor. I think what we know from COVID-19 and also sort of previous disease breaks, that it is associated with sort of an increase in anxiety, an increase in sort of depression. It's associated with many of us feeling angry and frustrated, particularly of those of us who are sort of subject to quarantine restrictions. But I think the key sort of warning sign for us to look out for is change in the quality and quantity of our interactions and activities. What do I mean by that? I think individuals who perhaps sort of over a period of time are sort of off their game. They're not as productive in their studies, not as productive at work as they previously have been. That's often a sort of a warning sign that maybe something is up, and it's important to sort of to ask, are you okay? I think one of the other issues that we need to be sort of vigilant for is a sort of change in sort of social interactions, sort of people not sort of going out perhaps as much as they did, or interacting with friends, family and others, and that's another sort of critical sort of warning sign. Jen, if I had a sort of time machine and I could go back, however, sort of 9 months to some of the messaging around the sort of the COVID-19 response, and don't get me wrong, it's been a sort of a really impressive global effort here. The one phrase I would change is I would replace social distancing with physical distancing. What we are seeking to communicate here is the importance of maintaining that sort of 1.5, 2 meters between us to reduce the spread of the virus. What we cannot afford, and most certainly can't afford in the context of our COVID-19 response, is any breakdown in the connectedness between us and other people. Therefore, that sort of warning sign around individuals sort of not connecting, individuals not sort of contacting friends, family, or engaging more broadly with the community, doing the things they previously enjoyed, is very clearly an important warning sign.
Well, we can start using it right away. Physical distancing it is. So if people see some of these warning signs, I'm just curious, and I'm sure other people are wondering, what are we supposed to do when we see that? What's the best course of action?
Thanks, Jen. I mean, I think the issue here is sort of don't be afraid. Sort of just remember sort of our humanity, and ask people sort of, are you okay? And don't ask, are you okay? And then turn to sort of to run away. It's sort of, are you okay? And yes, I'm interested in hearing your response. I sort of, I'm going to sort of attentively listen. You may not have all of the answers, and actually having the answers is not really the solution here. It's providing that sort of space, that opportunity for individuals to share the struggles, the issues they're grappling with, and if necessary, help them problem solve and signpost to sort of services that might be able to provide specific help. We as a community here at the University of Queensland, students and staff, one of the other things we can do, of course, is to upskill ourselves, to inform ourselves about mental health issues, to ensure that we have some of the tools, the skills to support people in distress. And I'm really sort of humbled by the number of individuals within our community who've engaged in mental health first aid training, for example. But I think the last thing to sort of to remember here is almost half of us at some point in our lives will experience a mental disorder. In any given year, 1 in 5. mental disorder is common. It is around us. It is highly likely that we know somebody, friend, family, colleague, who is struggling. So I think fundamentally, are you okay? And stay there in a supportive and friendly way to help them sort of share their experiences and, if necessary, help them work through some of those issues.
That's really great. When somebody asks, are you okay, it's really hard to give that answer sometimes. Why do you think the program's been so well utilized this year, Stewart?
I think the program has been sort of well utilised because the groundwork has been done. As I said, we developed a mental health strategy at the University of Queensland with and for that entire community, students and staff. And I think that entire community is behind this. We've been pushing against an open door. Casting my mind back 2.5 years ago when we launched the mental health strategy, 700 members of our community volunteered to get involved within a few days of that strategy being launched. Last year, when we were seeking to just smash the Guinness World Record for the largest number of individuals at a single event around mindfulness, a single mindfulness lesson. More than 2,000 members of our community got on board, and we've seen hundreds of individuals upskilling, going out of their way to develop skills to support individuals in distress, important life skills, important skills for our entire community. So I think that has helped shift the culture. And we as a community are increasingly comfortable asking each other, are you okay? We're not afraid of the response for that. And I think importantly in that context, we're much more comfortable sharing our stories. And I think in sharing those stories, we recognise that all of us have lived experiences of psychological distress, and all of us will have encountered and have individuals in our family and friend circles who have been struggling. And I think through doing that, we have begun to address the stigma that sadly has been so endemic within our culture, within our society for so long, and we're seeing the tide turn. So it's against that backdrop, I think, that culture shift, that willingness and openness of our community, some of the the process issues that we've been grappling with to improve access to services that have enabled us to support more people this year, building on the more people we helped the previous year, and that is great to see.
Absolutely, and it just seems like we can only build on that momentum, and I certainly hope that we all will, whether we're near, far, on campus or off campus. Now, Debbie, if I could go back to you, you certainly touched on some of the acute impacts for students around financial distress and how that's happening related to part-time employment, their families not being able to support them as much financially as they would probably like, et cetera. But there's also been the contracted job market, and many of our graduates will be entering the workforce fairly soon. We're hearing a lot from the government around job-ready graduates and, what are the employment prospects of our students that are entering into their careers, and how will their degree actually help them with that job-ready viewpoint, if you will?
Yeah, no, thank you very much, Jen, and it's obviously an area that we're very focused on at the moment. I mean, the Graduate Outcomes Survey, which the Australian government undertakes every year, its longitudinal results were released in August of this year, revealing that 9 out of 10 students with a degree were in full-time employment 3 years after they completed, and 4 out of 5 of them were in managerial or professional jobs. And these data are very stable, that if you have a degree, you will tend to do very well in the labour market, and across the course of your career, you will earn more. Economic analysis from the Reserve Bank has indicated that even in the context of a recession, the probability that our graduates will obtain full-time jobs hasn't really changed that much, although it may be tough as the first 3 or 4 months out. I guess from our perspective, we've been very pleased that the Commonwealth Government, through the recent budget, announced 12,000 new places for domestic undergraduate students. That's very positive. We are seeing, in the context of not many employment opportunities out there, what we call counter-cyclical demand, where school leavers and others are seeking out a university education. So we are doing everything we can to ensure that we meet that demand. At the other end, coming back to your point about Jobready, of course, this pandemic is occurring at the same time as we're seeing lots of changes to the nature of work. So we are very conscious of ensuring that we are preparing our graduates not only for the jobs of the present, but the jobs of the future. And that means embedding into all of our degrees opportunities, obviously, for global experiences, entrepreneurial experiences, digital skills, rich work integrated learning, we're revising a lot of our curricula to ensure that our graduates absolutely have the kinds of skills that they will need going into a rapidly changing labour market. And that's very important. We've had huge take-up of our entrepreneurial opportunities for students, and it doesn't matter what field you're going to go into, these are the skills that you're going to need. Digital skills, entrepreneurial skills, and a global perspective. So I would say we are very positive about the opportunities for our students, and we will do everything to ensure that they're well prepared to come out and be successful, as graduates tend to be. We're also obviously very focused on the fact that we have worrying levels of unemployment in our community through this period of crisis, and we have many more people than we would want who are underemployed. So we are also looking at the other end of the continuum, doing what we can to provide graduates who are out there looking for work, who are not fully employed, with opportunities to upskill and reskill to ensure that they've got the skills to continue to be successful in, as I say, a rapidly changing labour market.
So maybe I could ask you to expand on that just a little bit more about maybe the broader roles that universities are playing or could be playing or maybe will be playing on this, or what you think, if you could look into your crystal ball. How will universities play a role in the recovery?
And I've said this on many occasions, universities are a critical plank of Australia's road to recovery. I think we've seen this right through the pandemic. One of the things that we've seen every night on our television screens is expertise. Experts from our universities, from our research institutions, talking about how we as a nation respond to this pandemic. I agree with Stewart's comments on physical distancing rather than social distancing, but I think our community has realised the importance of expertise. And that has been something that I think has been demonstrated time and time again through this period. We're about to hear from Trent. We've also seen what happens in our university research to rise to the challenge of responding. In our case, with obviously the COVID-19 vaccine candidate, which, extraordinarily proud that this work has come out of UQ. But it's for the nation and the global community. But we've run hackathons with our students about designing new ventilators, so to ensure that if there is an upsurge in cases, we've got enough medical supplies to deal with it. Absolutely brilliant. But then as we look to that road to recovery, it's not only about skills and opportunities for students to ensure that sense of purpose for the future, feeling that you've got a place in the labour market for the future, but also playing our role as part of a coordinated ecosystem as we seek to work with government and work with industry to ensure that our economy comes out of this period stronger, more diversified than in the past. So new jobs, new industries, and we would have heard in the budget, federal budget last week, a lot of announcements around how do we as a nation respond to ensure we draw on our tremendous R&D expertise, but do that in partnership with government, in partnership with industry to deliver, as I say, those new jobs and those new industries which will be so critical to our future economic prosperity and also our social cohesion and the health and the well-being of our communities.
Thank you, Debbie. And I can't help but use that opportunity to transition to you, Trent. Speaking of expertise, you guys have been quite a bit in the spotlight, but I might start actually by asking if you think that the perception around the vaccine being the antidote to beating COVID-19, whether or not you think that that's essential in terms of rebooting the economy.
Yeah, thanks. Look, great to be here and have this opportunity to discuss some perspectives that we have who've been involved in this program. So I think it's probably just not that simple to think of a vaccine as the magic switch that will return everything to normal. It seems clear that there's incredible sort of heightened view on that, and where we're even seeing global markets impacted by results day to day that are come out on certain vaccine programs, which I don't think any of us would have believed before that if told us that was happening. But realistically, what we need is a multi-pronged approach to living with this disease, with COVID-19. And that really involves the things that we're all doing. So that's the enhanced public health measures, things like physical distancing we talked about before, and in the way that we go about our lives, as well as the idea of bringing forward effective therapeutics and treatments, which will probably always be required for those folks who have severe disease. And then comes vaccines on top of that. So this idea that we can just solve it all immediately is probably a little bit too simplistic. And I think really importantly, we also need to do that in a way that keeps our economy running. And we're seeing the struggles for that balance, I think, globally now, but that, in Australia, we're going to have to strike that balance as well, and we're all going to play a part in that. I was reading an interesting perspective recently that said that, if we take the situation back in the influenza pandemic of the early 1900s, it was those economies, those cities, those countries that were able to effectively put that balance in place were also the ones that rebounded economically the strongest. So I think that's a very important perspective. And lastly, I'd just say that we have to think about it as a staged approach. And a lot of people are using this terminology, new normal. I don't particularly love that terminology. I think we've lived with infectious disease since the dawn of time. This is just one of those things that we adjust to, and of course we're going to then hopefully wait for those longer term solutions like a highly effective vaccine.
Fascinating. I'm sure that you and the research team have never thought that you would be doing research that could affect global markets on a day-to-day basis, so no pressure. So the burning question, perhaps, when can we expect a vaccine? And as a follow-up to that, what do you see as the potential advantages and disadvantages of all the different vaccines we're hearing about in the news?
Yeah, it's a great question. I think when we started on this program back in January, and our response, of course, we were doing a number of press conferences, and this question would come up, and all of us were very enthusiastic in saying, look, we think we can get to a point of understanding of developing a vaccine candidate in the next 6 to 12 months. And of course, that immediately becomes UQ says vaccine available in 6 months, which is something that you have to learn and go through. The reality is, of course, that we knew at the time, and we know now that developing vaccines is complicated. It's going to take a little while to untangle, simply because of the number of candidates. There's now more than 300 candidates in development around the world, and I think in excess of 40 that are currently in clinical trials. So it's really going to depend on the region and the regulatory requirements of those individual regions and how data is accumulated. So that's a sort of long-winded way of saying we don't exactly know how these things are going to be staged. What we clearly know is that the scientific progress has been just astounding. So I like to use this statistic that there's more than 1,000 publications a week now on COVID-19 and the virus, SARS-CoV-2. That's just incredible, more than 50,000 since January. And that combined with the number of vaccine candidates we have is really, a testament to what Debbie was talking about earlier in the way that we can refocus scientific attention. In terms of what we really need to think about in how vaccines are rolled out and how quickly and to who, of course, we also have to understand the various subgroups that will need to get these. And so that's those at very high risk of severe disease. We know there's an association with age for this particular disease. We know that there's a range of occupations in which people put themselves at higher risk of exposure, whether that be healthcare workers working in a hospital setting, or whether that be people like first responders who really go out and they don't know what they're going to come across in terms of even responding to an accident, etc. So all of those things are going to become very important as we think about how to deliver a vaccine, how to get it out there. And of course, this might really also be important in the type of vaccine that you get. We're seeing a whole range of technologies being brought forward, some in the vaccine technology space, some are more traditional approaches, things that we've developed vaccines with in the past that we expect to be having a good chance of being an effective vaccine against this virus. And then we're seeing new scientific approaches that, if they're successful, they could really change the face of medicine and change the way that we think about infectious disease. So some of the vaccines that, for instance, use DNA or RNA as the way to deliver a vaccine. So all of these things are happening in parallel and makes the conversation quite complex. The other thing that there's been a little bit of coverage on, and we're starting to see more, I talked about how to get the vaccine out there, is also talking about how we're going to distribute at the global level. And of course, that's going to rely on supply chains. All these vaccines have different requirements. Some are required to be frozen at very low temperatures. That's going to be complicated in some regions. The vaccine we're working on here at UQ, we're hoping can be stored in a fridge, and that's very common for vaccines. So these sort of technical details will become absolutely critical as we try and roll out. So finally, I'd just say our approach has been a stacked approach where we've, like many others, said, look, we can't really wait for data. We really need to just move things in parallel. And that's where we've been able to bring forward things like manufacturing readiness, thanks to the support of many of the donors, and thanks to the financial decisions that we've been able to make very quickly, take that financial risk to move quickly, running in parallel with our testing. But we also have to do that without taking any shortcuts. That's really important, that we understand, we gather the data, we analyze the data before we move forward. So I think, all of that said, we're all very hopeful that vaccines can start to be delivered in 2021. I know that we're working as fast as we can, and we'd all like this to be here today, but we just have to make sure we make those right decisions as we try and bring forward a solution to this.
Well, certainly it's good to hear that safety and efficacy are the top of the list, and nothing's been compromised in that, right? And with so many people working around the globe, it does feel really hopeful to hear that update. So I really appreciate that, Trent. You mentioned a little bit about the distribution around the world, and I think a lot of us have seen in the news that Australia has secured doses of the UQ vaccine. What are some of the options for our alumni and partners living internationally?
It's an absolutely critical question. Interestingly, the reason that the team had funding to initially work on this platform, they've been working on it for quite a long time, the platform that we're using here at UQ for the COVID vaccine, is that a group called CEPI, or the Coalition for Epidemic Preparedness Innovations, had provided initial funding to look at bringing forward new platforms for emerging pandemic diseases. So that was a very forward-looking sort of perspective by that group, and what has let us get started. And one of their core tenets to their funding is equitable global access. And I think that has to be front and center in our mind as we think about developing these vaccines. We know this is a fight against the virus, and essentially we don't win unless we all win, and we all win from a global perspective. So as part of the agreements that we have in place, there will be a certain allocation of this vaccine that's produced, we hope, that goes into the COVAX facility for global distribution. Obviously, there's a lot of complexity around that, but that organisation is really looking to say, okay, whichever vaccines are able to make it through, whichever ones are going to become available, that there's a mechanism to distribute those who need them most. And of course, there's going to be many regions of the globe in desperate need, and they don't obviously have in-country or sovereign capabilities to either manufacture or, in many cases, even distribute. So there's going to be a need to be a coordinated global effort to manage that. And that brings up another issue, that what we've seen is the emergence of this topic of vaccine nationalism. And of course, it's natural for any country to want to find mechanisms to support their own citizens, to support their own regional security needs, and I think that's natural. But I think it's also the responsibility of the world's most powerful economies to support those who are in need. And I think all of us in the vaccine team here really believe that. And so we were very glad as part of the agreements that some of that was taken into account. And it's also why we've been very glad to work with CEPI on this program.
Now, it sounds to me like the first step is find at least one successful vaccine. Next, get it in the right hands. But already there's been discussion about some hesitancy around receiving the vaccine. What would you say to somebody who has that sentiment?
Yeah, clearly it's a personal choice. For all of us, we make health decisions. It's highly personal, and we try and make the best decisions we can. So I would say the best thing people can do is try and be informed. That's difficult today, sometimes trying to sort out what's highly reliable and accurate information from inaccurate, and I think that can be challenging for people. But I also think in today's society we've lost a little bit of how we measure risk. And so I always like to think about this in simple terms. For instance, a lot of us wouldn't really think twice about getting in our car and going from A to B, yet we know that cars can be quite dangerous. And if you look at from a true risk point of view, if you're an actuary or you're looking at risk measurement, that might be something that you would suggest carries with it a significant risk. And so sometimes I think when we think about vaccines or other things, the actual risk can get a little bit skewed. That's not to say that there isn't inherent risk with all of these things, but the other piece that's become less clear, particularly to us in developing countries, is that we've lost sight of how dangerous infectious diseases can be. And I think it's because simply many of us are vaccinated as children. We have access to antibiotics that are effective against most things like infection. And so for us, this doesn't often reach through into our daily life. Whereas I think if you have a chance, or if you've ever traveled to developing countries and you look at the number of people who are dying from things like tuberculosis or cholera, you realize how quickly those small things we take for granted can become really life-threatening situations without those tools. And I think of that as the same way as vaccines. If a vaccine comes forward, as a scientist who's focused on vaccine and therapeutic development, there's only one thing that drives me, and that's really to think about creating a healthy world, a healthier world, and finding solutions for grievous illness. Vaccines have prevented so much unnecessary death and disease, and this really, to me, outweighs any real or perceived risk. So for me personally, it's a no-brainer. These vaccines go through extensive safety testing, as you're seeing. The way the clinical trials are designed, we understand that this has to be a product that's absolutely safe before it can go and be widely distributed, and that's clearly the focus.
We've had kind of a unique ability to follow along on your journey because of the donor involvement, and it's been nothing short of extraordinary. We've seen a fair bit of those ups and downs, probably more of the ups than the downs, because your team has been nothing short of outstanding. Can I just ask, from when you reflect on the last few months and really the treadmill that you've all been on, what's been the most standout moment for you during this entire process so far?
Yeah, that's a great question. I think one of the things that I think I wish I'd done that a lot of people told me to do was, keep a diary or keep a short summary of each day. And I think when you're in the middle of it, you kind of think, oh, well, I'll remember all of those moments, I'll remember all those things. But now months into this, it's getting harder and harder to recall all those details of what happened as we, Keith Chappell and I rushed off to the US in February, or all of the different things that was happening back then as we were trying to understand more about this outbreak. So, but the question about what's the most outstanding, I would have naturally, as a scientist, thought that it would be some technical breakthrough that we had, some amazing aha moment in the lab as we were going through, and there's been many of those this year. But really what it's been is the way that the support has come, and the support's come in a few different ways. So the way that the scientific community has supported us as a team through providing collaboration, I think that's been a highlight. But equally so, and perhaps more so, has been the way that the giving community has got behind us. And really, we were just blown away by the support, the financial support that was provided from the smallest donation to the largest, that really let us think about having those financial resources to make very quick decisions, to move the program as fast as we could. We felt the urgency, the sense of urgency from day one. And so that really was the amazing standout moment. So for instance, now in our building at the University of Queensland, we've got a whole wall that's filled with letters from school children spurring us on. We've got a number of examples there of fundraisers that school children have done. So it's all these things from the smallest to the biggest. It's really just been one of those things when things are tough, or you're on a late night Zoom call, or you have to get up early, that's kept us all going and really been inspirational for us as the team.
That's really, really heartwarming. Thank you so much for sharing that. And we all will be cheering you on, I assure you. All those kids that have their pictures up on the wall, and all of us in the community, near and far. So absolutely perfect segue, thank you, Trent, to transition back to Giving Day, which is how we started our discussion today. Debbie, we've asked our community, who are in the position, of course, to support students experiencing financial hardship, or one of the many other incredibly important causes at UQ. Can I ask, what do you think will be the future of philanthropy in a post-COVID world?
I think, Jen, it will be very strong. I mean, I think what has been inspiring and humbling through this whole period is the extent to which people have given to the vaccine project, to our students, to others outside of our community, even if it's just a small amount. I think what this extraordinary period has done is make us all concerned for our communities, for our families, but our broader communities. I mean, we've all been exposed to seeing pictures of people outside Centrelink, looking, shots of what's happening in other parts of the world, that I think that all of us feel the need to try and help. And what has been achieved through our community of donors is, as I say, absolutely inspiring and absolutely humbling. And I don't think that good is going to stop. I think, if anything, it will continue as we seek to rebuild our community and our sense of purpose into the future. Our students are absolutely still, many of them are still in financial hardship. We recognise that. We are looking particularly at, we have a number of students who are studying at UQ who are international students who won't be able to travel home over the summer period, looking at ways that we can support them, looking at ways that we can support all of our students, because of course a lot of that part-time work hasn't come back. And certainly, if I just take myself as an example, I will be seeking to provide support for that fund, ongoing support, but also when we know that education is going to be so critical to the future, to future livelihoods, I'm also keen to provide my support for the Young Achievers program. It's a wonderful program at the University of Queensland, obviously led by significant donations from Andrew Bryce and Jennifer Bryce. It is a program that genuinely makes a difference. It provide support for students who are keen to go to university, have the aptitude for university but don't necessarily have the resources, provide support and mentoring for them in the latter years of high school, and then support when they come to university. They're the kinds of programs that are going to be absolutely critical to the future to ensure that there's not a generation that's left behind through this crisis. So I think the good will continue, the good that we have seen in our community, and as I said at the beginning, not only among our alumni and our other supporters, but also from our staff and also from our students. It is inspiring and it's humbling, and I think we will see it continuing.
Thank you so much, Debbie, and please allow me to thank you so much for your generous support of the Student Hardship Initiatives as well. So, Trent, many guests in our audience are asking what they can do to help. Do you need volunteers and funding? I would also add, while I'm at it, there are many asking how long the vaccine immunity will last. And if it will be effective against mutations of the virus. So maybe we take one and then see if we can get to the other. How's that?
Sure. Why don't I start with the question around volunteers and funding? So for our ongoing clinical trial, that's the initial part of the clinical trial that's going on here, we'd put the call out a couple of times for Queenslanders mainly just due to travel restrictions and other things, because we're doing the clinical trial here in Brisbane. And again, we were blown away by the number of people who were willing to come and try and support that and volunteering for the trial. I think after we did the initial part of the trial, we expanded it into an older age group for those 56 and over. And I think after the first day, there was something like 7,000 phone calls into the clinical trial site. And I think it actually melted down the phone system, and that was fantastic to see. So for our part of the trial, we don't need any more volunteers at this stage. I will say that what's happening if things go well and the results come out, our partner CSL will be expanding into a very large clinical trial, approaching 30,000 people, but that will need to happen in parts of the world where there's significant community transmission, and we hope that's not here in Australia. So no more volunteers for us right now. In terms of funding, again, we're very fortunate through the support we've had to get through this period. What I would say is most important is that the only reason that University of Queensland was able to respond not only for this vaccine but other research areas like you heard about before is because of fundamental research. And I think that's an area that can always be supported. It's really through the great work of the many talented people we have at the university that we can bring these solutions forward. You heard of the idea of expertise before and the value of expertise. And I think it's, having funding that comes from the community into those programs can be really differentiating, can give that boost that could go from the program that just needed that extra bit of support into something that could be tomorrow's breakthrough. So that's something I'd always encourage people to think about. Sorry, I know I've forgotten what the second question was.
Well, I couldn't help but try to fit in as many as I could, Trent. By the way, I should add, if you haven't already put any of your questions in the comment box below, please do so. We'll do our absolute best to get to it. So I was trying to pack in as many as I can, so apologies, Trent. So the other question was how long will the vaccine immunity actually last? And will it be effective against mutations of the virus?
They're two great questions, and they're questions that the scientific community's trying to get answers to right now. So in terms of how long the vaccine will last, the short answer is we don't know yet. We expect that this could be a virus that requires some type of continuous vaccine program, a little bit like we do every year for influenza. We don't know of how often that will be, whether it'll be every year or every few years. I think that's something that's still to play out. But that's something that happens. That's something that is organised for other diseases, like I mentioned, for influenza. So I think as we learn more, as we see how effective these initial vaccines are, that those programs will be put in place, and it will just become one of the normal ways that we operate. In terms of that is a concern that many people have around, is this virus mutating? How fast is it changing? The reality is viruses, they do change. The good news is that so far what we're seeing for SARS-CoV-2, that this is the virus that causes COVID-19, is that the changes don't appear significant at this point. And it also appears, if we look at what's coming out in the scientific literature, if I'm speaking as a scientist, that all of the initial data says that the vaccines being developed should be broadly effective against a wide, the current strains or changes in virus that are out there. So I think that's very good news, and we're hoping that that's the way it continues and that these vaccines will be highly effective.
So another question for you, Trent, in fact, I think it might have to be our last, is related to side effects. So we've seen in the news quite a bit about, well, everything is public with these trials, which must be incredibly pressure, must apply a considerable amount of pressure. But, when people talk about side effects or putting pauses on these things, what are some of the side effects that you're seeing in terms of the vaccine that we should be aware of?
Yeah, so there's a couple of things to take into account for vaccines. I mean, one, the very obvious thing is that vaccines aren't drugs. They're not given to people sick with a particular disease, especially the one that they're designed against. They're given to healthy individuals to protect against disease, or they're given to everyone who can qualify for the vaccine to protect against disease. And so that means that the safety bar is very, very high, and the types of things that we need to look for are well known. So for many of us who've had many vaccines, it's the typical things. So things, because vaccines, especially these ones, injections, can be some injection site pain, some local reaction there that just means that your immune system is activated. Some other things that have been seen with some of the vaccine clinical trials are things like headaches or mild fever. So these are the things that we normally see with vaccines and that we would expect. Obviously, people are looking at now across the large safety trials that have started to make sure that there aren't more severe side effects, and those are things that are really rare events we're not seeing. And we're hopeful that the most important thing is that we can develop a very safe and highly efficacious vaccine that provides good long-term protection against this virus.
Well, I think I can speak for all of us and say we hope so too. So with that final question, it is unfortunately time to draw our panel discussion to a close. If we did not get to your question, we will do our absolute best to see if we can field you an answer after this. There was just too much good discussion to be had. But I would like to thank you, Debbie, Trent, Stewart, for your time and, of course, for the incredible work that you're doing. And, of course, thank you to all of our alumni from around the world who tuned in to listen to this discussion. Please feel free to share it with your friends. I hope you've taken as much from this event as I have. If you check your inboxes next week, you'll find a full wrap-up of all things Giving Day 2020, including activities and our digital version of the Contact magazine. Because of you, I can't say it enough, the good does not stop at UQ. And if you can join us to support student emergency support or areas of your choice, please be assured that in regards to student need, your gift will be matched by the university. Simply follow the function also in the chat. So thank you once again, everyone, for your time today. I hope you enjoyed the rest of your day, or perhaps wherever you may be in the world, your evening. Have a great evening.